A lot's changed since March 2020. We went from scrubbing our entire grocery haul of potential COVID droplets to attending overcrowded summer festivals. The only constant during this pandemic is America's constantly evolving messaging around face masks. Mask guidance got off to a bumpy start, even before the World Health Organization declared it a pandemic. In late February 2020, the U.S. Surgeon General told the public not to buy masks because he didn't think they protected people from the virus. But with cases ramping up across the nation in April of 2020, the CDC finally urged all Americans over the age of 2 to wear masks outside their homes. This back and forth was super confusing, but Dr. Fauci tried to clear things up.
And it was at a time when personal protective equipment, including the N95 masks and the surgical masks, were in very short supply. And we wanted to make sure that the people, namely the healthcare workers, we did not want them to be without the equipment that they needed.
But throughout the spring, former President Trump and Vice President Pence contradicted the CDC by not wearing masks themselves, even where they were mandatory. By the summer, and despite overwhelming evidence that masks really do work, masking became so politicized, it basically split us into two Americas, with one masking up for protection, and the other rejecting face coverings as an infringement on personal freedom. Masking wasn't always consistent at Black Lives Matter protests, but they were even more rare at large Trump rallies. Trump did go on to urge his supporters to wear masks by August, but that message was short-lived. In October, Trump returned to the White House after being admitted to a hospital due to COVID. He immediately took off his mask for the cameras before going inside, and this came hours after he tweeted, quote, "Don't be afraid of COVID." In the months that followed, the U.S. would see its highest spike in COVID cases. Not much changed in terms of mask guidance on the state or federal level, but most states had some sort of mask mandate in place at this point in the pandemic. Things began to look different once President Biden took office. Within the first 5 days, he signed a flurry of executive orders requiring masks be worn on all federal properties, on public transportation and in airports, and reinstating travel restrictions from places like Britain. In the next 2 months, the number of vaccinations steadily increased, and the number of COVID infections plateaued and started dropping. So the CDC released much anticipated guidelines stating that vaccinated people can gather in small groups, indoors without masks or social distancing. It was the first indication that things could be returning to normal. And eventually, the CDC relaxed mask guidelines again on April 27th, saying that fully vaccinated people could enjoy being outside without a mask, something that many vaccinated and frankly unvaccinated people were doing already. Just a few weeks later came the biggest change to mask guidelines. The CDC announced that fully vaccinated folks could ditch the face coverings and avoid social distancing in most situations, in part due to a significant drop in cases and a spike in vaccinations. But not everyone was ready to give up on the masks entirely, and some experts questioned whether the move was premature.
Why not create a metric? Why not say, look, these vaccines work. This is great. As soon as you hit this mark in your state, we say drop it. That
brings us to today. Cases are rising across the nation, largely due to the Delta variant. And because nearly half of Americans are still unvaccinated, the CDC is scaling back their May guidelines and asking vaccinated people to wear masks inside again in places with high COVID transmission rates or low vaccination rates. They also recommend mandatory masking for all kids in K through 12 schools.
They're changing their advice to the American public, their public health advice, based on evolving data and an evolving historical guidance. That virus. That's exactly what they should be doing.
White House Press Secretary Jen Psaki says President Biden is prepared to wear a mask again if health guidance demands it. But administration officials are worried that returning to previous mask rules could hurt the already stalling vaccination rate by taking away one of its most attractive incentives. And for many Americans, that's the rub here. Are masks being used as incentives or for virtue signaling or as a true public health measure? We're learning in real time that clear, evidence-based communication can be just as important in stopping the spread of the virus as the masks themselves.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.